Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Today I wanted to talk about something very important, and this is not only about how normal labor is taken care of, or it is not only about women in labor and what they want. It's more about the comfort measures that are very, very important for labor and labor pain relief. Now, if we have to talk about comfort measures, there are many, many comfort measures available, but in labor, hardly, people think about the comfort of the woman. They are always oriented, maybe the medical fraternity, or maybe the nursing staff, or maybe the attenders, or the partner, or everybody and anybody are the focus. They have different kind of focus. Now the doctor's focus is over taking her through normal labor and delivering her. The nurse's focus is on say the monitoring of the heartbeat of the baby, the monitoring of the say you know about the pulse of the pregnant lady, or the BP of the pregnant lady, and all this. And the husband is more worried in terms of the outcomes and the safety of the wife and all that. And the attenders, the parents or their in-laws or friends, are all waiting for the D-Day. Now, in so much of a split and thought process and activities that are happening around, at one point of time, the pregnant woman feels that I am left over with my pain. Now, this is another point that we really have to take care of. And I feel that no pregnant woman should be left alone with her pain as a factor, that she feels that everybody wants the outcome and nobody is bothered about me. And that is one thing that really bothers in that given point of time, and at a later date also, when she is looking into her past, and when she's looking into any other kind of an issue, she'll be having these kind of thought process that is running. Now it is very, very important that we take care of the woman's comfort measures, which are very important for labor pain relief, to ease the labor pain, to ease her stress and tension, and directly or indirectly that will promote relaxation, and also promote that soothingness that comes into her because of the care and efforts that because of the environment that she is in. So we should make things possible in such a way that there is a relaxing, soothing environment for her to go further into labor and delivery, and to deliver without fear and without any stress of having that pain factor and that pressure factor and all these things. So it is very important that we create an environment around the laboring lady, that she is also comfortable in whatever measures, in whatever frequency that she wants. So it is very, very important that we should take care. And there should always be a calm environment, and it should not be chaotic. It should not be shouting and yelling and screaming and all that, especially when she is in early labor. The calmer the environment in early labor. Anyways, in the second stage, it is all about pushing, and it is all about motivating her. It is all about telling her to do her best. So at that time, a very calm environment is not that very possible. But yes, in the first stage of labor, when the labor process has entered and she's going through dilatation process, it is important that you create a calm environment, and that environment should be soothing for her in terms of her five senses. And she should be calm in terms of the noises that are coming, in terms of the smell, and in terms of the any food that she's taking, and all these things that are very, very important. So I always tell that it is non-pharmaceutical, non-pharmacological labor pain management. So nothing about medicines, nothing about giving her some drug or some sedative or some painkiller and all that. It is nothing about that. Actually speaking, painkillers will never work in labor and delivery, because that pain and that tension is beyond the concept of labor, beyond the concept of inhibiting pain. So I always trust in non-pharmacological, that is non-invasive labor pain management, and usually make sure that things are ensured in the surrounding where the pregnant woman is laboring, and her other things are taken care of. For example, one by one we can discuss that today. I wanted to talk about the birthing ball. Okay, a birthing ball is a huge, such a big ball, and it is soft, and when you sit on it, it gives that flexibility, and it allows the gravity to work on the baby's position and allow delivery to happen. When somebody is put on a birthing ball, their center of gravity helps the process of delivery happen, and whenever there is contraction, you need to put a softer movements and push the ball down and again bounce back, and push the ball down and again bounce back. So by this the head position slowly comes down, and not only about the head positioning coming down, whenever there is no contraction, even you can do your pelvic tilts, moving forward and backward, so that the space in the pelvis increases. Along with this, you can move lateral towards one side and again towards the other side, flexing and extending your legs, so that again that helps the hip movements and gives you relaxation and lot of activity to be when you are in labor, and it helps a lot. So birthing ball is one of its kind of a thing that helps labor and delivery achieve, and it is really comforting at times for pregnant women. So birthing ball is one such a pain management measure also, you can say, and it enhances the speed of labor, and it improves the outcome and faster reaching the delivery faster. So that is one measure. The second measure can be patterned breathing. Whenever you ask them to breathe, so there will be an entire session on breathing, but yes, we are talking about some comfort measures that are really going to be helpful for women delivering. And pattern breathing, whenever you do not have contraction, you can have your normal breathing pattern, but whenever there is contraction that is coming or the pain that is coming, you inhale deeply and exhale deeply. So take your breath from the nose and leave your breath from the mouth. So this is what one kind of a breathing pattern that really helps pregnant women have that soothing sensation, and it decreases the attention that is going towards going towards labor and pain and all that. So all that she has to do is, whenever she is not in contraction, she can have normal breathing, and whenever there is a contraction which is coming like an ocean wave slowly towards her, she can actually have this breathing that will help her eventually dilate. It will also help her eventually with pain relief. It will also help her eventually with decreasing the pain sensation. So concentrating and breathing techniques are something that will help the pregnant woman in the longer run, and also it improves the oxygenation. So deeper breathings give a lot of oxygen to your lungs, and in turn activate the muscles for a better contracting capacity. When you have a contraction and you shout and you yell and you scream, your complete attention, focus, energy, everything gets deviated. So whatever energy that you have, you conserve that energy and you take that energy towards providing nutrition to the muscles that are involved in labor and birthing. So that is the main concept. So if you are out of your control and if you shout or yell or different kind of movements, if you do, you are going out of focus, and the energy that is used for all other things is 10 times more than what you use for labor and delivery. So you should be focused and you should be well versed with this common problem that we are having. So the more you focus, this all comes with the birthing education that we give, the classes that we give, the one-on-one training that we give, and the kind of confidence that we give, that they are oriented when they are in labor, and what they have to do they'll know. So nowadays pregnant women or the couples, they are extremely busy with the day-to-day activities, and they are not very well for the labor classes and antenatal classes and all that. So they are not well versed with what actually they have to do in labor. So there is a lot of confusion, there is a lot of chaos. On top of it, there is pain, and on top of it there is so many people giving you tips and tricks and all these things, and they are not focused. So when your education of labor and confidence is given properly during antenatal classes, you will not have this chaos running there. And the third thing is, whenever you are in labor, try to have some food. So food gives energy, and food gives that satiety to you. An empty stomach gives lot of irritability to the brain, and your muscles will not work when you are dehydrated. So some beverages, whether it is warm or whether it is cold or whether it is whatever you like, keep hydrating yourself, keep taking food that is good for you. Eating something or drinking something will give you that energy that is needed, and also will not keep your stomach empty. That will, a growling stomach gives lot of irritability, and at times you reach a point that people have headaches when they have empty stomach and all these things. So it is very important that you are focused and you have some food that is good for you, and food that is friendly for you, and food that you actually like having. And some people have food which is very particularly when they are not feeling well, or when they are having this trauma or agitated feeling, and they resort to eating certain pattern of food or drinking certain pattern of liquids or soups or juice. So you can replicate that here, and it will help you a lot. And another very important thing is movement and position changes. Whenever you are in labor, it is no hard and fast rule that you should lie down and you should take in the pains. Absolutely no. You can move around, you can climb stairs, you can get down the stairs, you can walk around in the room, you can stand near the window pane, you can watch people outside, you can take support there, and you can do squats there. You can be as active as possible. You can hug your partner, and you can have a calming, we call it as a ball dance. And you can still, whenever you are having contractions, you can go to Bollywood music also. And even Bollywood music helps you a lot in pelvic exercises and pelvic tilting, and improving the outcomes of labor. So whenever my excuse me, whenever my labor staff calls me and says, "Madam, we have an inertia that is happening from past 1.5 hours, she has not progressed and she's little agitated," I make it a point that I stop my OPD, I go to the labor ward, I stand there, I play some interesting music, and I also dance along with the laboring woman. So recently also we had one cardiac patient who was on a pacemaker. She was a second time mom, but she was not progressing because she had the fear of that pacemaker in her, and she had the fear that it is going to be a threat for her life, and she was not progressing. Then we in fact started music and we started dancing. First I did a little bit of massage therapy, a little bit of acupressure, a little bit of confidence building into her, relaxed her mind. I just broke whatever inhibitions that she was having, and then we started off with music, and we started off with dancing for 2-3 songs, and then immediately in half an hour she progressed well, and in 1 hour she delivered. So this is what happens. Your inhibitions come from your subconscious state, and if you break that inhibitions and you break the subconscious state, you will progress faster in labor, because labor is all about syncing your inner self, outer self, physical self, and going through the process of birthing. So it is very important that movement and position changes happen on a regular basis. There is no scope of lying down. And in fact, the Hillrom bed that we have in Cuddles, that gives a lot of flexibility in terms of giving the pregnant woman the needed positions: head up, head down, left lateral, right lateral, then squatting, positioning, standing, any kind of position that is possible with the Hillrom that is available. And the next point that I wanted to talk is about heat and cold. There are two different mechanisms of stimulating your cutaneous, so your skin. So whenever you stimulate your skin, it gives signals to the brain, more preferential signals than the pain. So you block the pain signals. So when you put hot compressions, the signals go, and the hot compressions become very soothing. Similarly, when you give cold compressions, that is another signal that is blocking. So hot is blocking and cold is blocking, the pain is completely blocked. So this is what is the principle. So usually what we do is we have this rubber bags with hot water, and we keep compressing over the back, in the lower abdomen, in the groin area, in the lateral part, wherever there is stretch and pain that is happening. And at times cold compressions also at places where there is trigger point and pain that is severe. So this alternating heat and cold therapy will work wonders in labor, and it not only helps deliver smoothly, it also helps divert a lot of problems that the pregnant woman is feeling, and they feel it more comforting and more relieving in terms of giving that friendliness to the skin and contact and touch. So in labor, most of the people forget that the woman needs that sense of touch. So we will do an entire session on what touch is during labor and delivery. What kind of a touch, what the laboring woman needs from the partner, from the attenders, from the nursing, from the doctor. All these things bit by bit we will talk in one whole session. What touch means to a delivering mother. So other than the superficial heat and cold, we also give counter pressure. Wherever there is lot of pain and pressure coming, if you put counter pressure, maybe in the pelvic area, maybe in the spinal area, maybe in the the spinal cord area, maybe in the shoulder area, wherever this neck and shoulder and the back part, if this is relaxed, actually if the neck, the shoulder and the back is relaxed, labor progresses as fast as possible. So there are measures, pressure and counter pressure measures, that we actually do, that I also actually do whenever there is a stagnation in labor and delivery. I personally go and do, because those are the techniques that your hand has. Maybe it is not there in other consultants, maybe it is not there in the staff. There are certain important techniques that I have learned over 20 years that gives me the freedom to judge which measure works where, and we try to give that comfort measure to the pregnant woman who is delivering. So that comforting measure, that pressure points, that acupressure points, whenever you give, there is absolute relaxation, and in half an hour the labor progresses and they deliver. So counter pressure techniques are very, very important. And about touch and massages and all, definitely they have a role in women delivering. And People don't know that aromatherapy also works. Whenever some women have preferences, say that is all about your birth plan. So somebody has a birth plan, come to me that, doctor, I like the smell of say roses, or I like the smell of lilies, or I like the smell of jasmine. I want my labor room to be full of that kind of a smell. Can I go ahead with it? I said, absolutely, go ahead with it. Whatever your like is there, this is your D-day and we will arrange for it. And a diffusion pump or an aromatherapy area, we make sure that it happens. And this also comes with self preferences. I cannot induce my preferences onto the pregnant woman. And if I like the smell of say water lily, and I can't put water lily smell, if she does not like it, she'll get absolutely irritated. So this is where the birth plan comes in, and what arrangements you have to make from your end for your comfort measures. It is very important that comfort measures are taken care of, and aromatherapy really works wonders. And in fact, at times when the labor is not progressing, I have a lot of tips and tricks wherein I ask my class 4 employees to take her for a bath, and when we give her hot water bath, we put some essential oils in the bath, wherein those essential oils give unknown relaxation to her. So this is all a matter of practice, and it is all a matter of tricks that we use for labor and delivery. And that bath itself, kick starts her dilatation from 3-4 fingers to 8-9 fingers in say about half an hour to 45 minutes. So there are things that do work, and relaxation is something that acts on the subconscious mind, and it gives better results when your subconscious is calm. The more agitated women in labor are, their subconscious is blocked, and it doesn't work and it doesn't move forward. And other than the water, as I have told you, for taking bath and aromatherapy, water also is used for sitting in water, and the water birthing that we had a session, that is also extremely working for women who are highly motivated and who have naturally entered labor and delivery, who do not have big babies and who do not have any other complications wherein actually we have to take care of laboring them. So, and there's another method called focus and distraction. So we make sure that our staff is talking about something, and their focus is deviated, and we talk about something that in the third space, and we say, how did you like this, or how did you like that, and what has happened here, and what has happened here, and what would your baby be named as after delivery, and what would you like to do in your baby's future. So all these things, so we try to engage and distract. So engaging and distracting women who want to labor and deliver is very, very important. And the more you're vocal about yourself, the more you engage, the more the birth room staff and the doulas and the birth assistant and the labor room staff are interacting with her, just not leaving her for her pain. The more the interaction is, the more the engagement is, the more better results come in. And there is one very important thing that I always talk about is the audio analgesia. So whatever you talk, whatever you speak, whatever you motivate, it is working more than the anesthetic agents. I have experienced that whenever that happens in the labor room, the more of talking that you do, the more motivation that you give, the more interaction that you have, the more enthusiasm you create, definitely helps in labor and delivery. And I have seen wonders when touch has worked, when talking has worked, and when heat and cold have worked, when different positions have worked, when favorite food and favorite music and favorite smell, all these have worked wonders in labor. It looks like a comedy when we talk about all these things, but no, absolutely they work, and they are really influencing mothers who are delivering, and we have to break the monotony. Whenever you break the monotony, you discover something new, and whenever you discover something new, you will have one solution that really actually works for that person who is really in need of it. So science is all about lateral thinking. Science is all about deviation from normal. Science is all about discovering new things. Science is all about giving that kind of an individual attention and individual tailor making decisions that we really have to do for women in labor. It is not about books. It is not about the mechanics of labor. It is not about the system of labor that it works. Yes, all that is in place, but nowadays it is beyond all these things, and women in labor need not sophisticated things, but simple things that actually work for them. So this is all about today's class, though there were some overlaps in the last discussions, but yes, repeating things will give you more confidence, and repeating things will give you the actual place where they have to be placed. And repeating things gives affirmation. Repeating things gives more stronger message that yes, this is important, and yes, this is needed. And every woman in labor has to be given an option of her choice, of her it's an important day for her, and her health is very important, and to give her that comfort is really important. So my principles of practice have always been very different, and I always think out of the box. I do not think like an obstetrician at all. Yes, professionally I am an obstetrician, but I always think out of the box and create new things for pregnant women and people who are delivering and in labor, because that is really important and the need of the hour. Because there is fear of going through normal delivery, and which is taking away from the concept of normal delivery, and people are opting for cesarean sections, unwanted cesarean sections, just because of fear. Absolutely not warranted. So let's unwind this again and again, and we should make positive affirmations in pregnant women, encourage them natural birthing and normal birthing. So this is all for today. Thank you all for watching, and there were so many viewers, and any questions, any topic that you want me to talk, I will talk, and we will make sure this forum goes more with interaction. And the more that you want me to talk on, and we can create new topics, and we can create new solutions, and we can create new environment and everything for normal delivery. So that's all for today, and see you all tomorrow with yet another topic, and let's encourage normal delivery and natural birthing. Bye.